welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's updates from the medical world. About new research that has concluded that men at the highest risk for prostate cancer could be fast-tracked for investigation if their genetic risk was considered in general practice. Prostate cancer accounts for around a quarter of new cancer cases in men. Approximately 52,000 men are diagnosed per year in the UK alone. It is the second most common cause of cancer death in men in the UK, and 5 years survival doubles if it's diagnosed at an early stage compared to advanced stage. Symptoms are common and easily misdiagnosed, and an estimated 14% of prostate cancer deaths could be avoided if they were diagnosed earlier. A large-scale study by the University of Exeter, published in the British Journal of Cancer, looked at the impact of incorporating genetic risk for cancer into the GP, triage and referral processes. The research concluded that considering genetic risk could improve referrals for those in need and, importantly, avoid invasive biopsy investigations for those at risk of cancer. Accessing genetic risk in primary care could lead to earlier diagnosis for men most at risk of prostate cancer. The research team estimates that incorporating genetic risk for cancer into GP triage could mean 160,000 men could be expedited for fast investigation, while 320,000 of these could safely avoid referral and unpleasant investigation. At the moment, PSA test is used to investigate men with erectile dysfunction or urination problems, but the accuracy of the test is unclear and false positive results are common. Only 1 in 3 men with a positive PSA test have cancer, and invasive and unpleasant biopsy is often needed for diagnosis. Research shows that PSA test can miss around 15% of cancers. The team calculated genetic risks for prostate cancer using more than 250 known genetic variants linked to the disease. These genetic variants are combined into a single genetic risk score, which describes an individual's genetic risk of developing prostate cancer. They applied this to data from 6390 white European men from UK Biobank, whose records show that they had seen a GP with potential prostate cancer symptoms. A new research that identifies a simple trick that may reduce drinking. A new study published in the scientific journal Addiction has found that households in UK consumed about 6.5% less wine when drinking from smaller glasses than from larger glasses. This randomized controlled trial recruited 260 UK households from the general population that consuming at least 275 cl bottles of wine each week. During 2 14-day intervention periods, households were asked to buy a preset amount of wine to drink at home in either 75 cl or 37.5 cl bottles in randomized order. They were also randomized to receive smaller or larger glasses from which to drink. Volume of wine consumed at the end of each 14-day intervention period was measuring using photographs of purchased bottles, weight on providing scales. Using smaller glasses reduced the amount of wine drunk by around 6.5%, although there is some uncertainty around this effect. During from smaller bottles reduced the amount of wine drunk by 3.6% per fortnight, but there is greater uncertainty around this effect. Wine is the most commonly drunk alcoholic beverage in Europe, and most of it is consumed in homes rather than in bars, restaurants or pubs. It's already known that using larger glasses increases the volume of wine sold in restaurants, and the size of wine glasses in general has increased dramatically over the last 3 decades. If the effects of wine glass size on consumption are proven reliable with effects sustained over time, reducing the size of wine glasses used in homes could contribute to policies for reducing drinking. These policies could include pricing glasses according to capacity to increase the demand for smaller glasses, and regulating glass sizes in bars, restaurants and other licensed premises to help shift social norms for what constitutes an acceptable glass size for use outside as well as within the home. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.